Hi, welcome to the second episode of You, Me, and HAE, a four-part podcast series. I'm your host, Debbie, and joining me today is Kelly. Kelly is a travel enthusiast and she loves to cook. Sounds like my kind of person. She also happens to have hereditary angioedema, or HAE. HAE is a rare disease that's caused by either the body not making enough of a protein called C1 esterase inhibitor, or C1 inhibitor, or when the body makes enough of it, but it doesn't work right. And this results in periodic swelling that can be painful, unpredictable, and life-threatening. This program is sponsored by Farming Healthcare Incorporated. The speakers have been compensated for the presentation of this information. The information contained within this podcast is for educational purposes only and is not intended to be medical advice. This episode will discuss experiences of people living with HAE. It is important to recognize that these experiences may not be representative, as every person with HAE has a unique disease course. So, welcome again to our second podcast in the series. I am Debbie, and I'm host for all of the conversations. I have 4 adult children, and 2 of them also are living with HAE. I am an English as a second language or ESL tutor, but when I'm not working, I enjoy cooking and eating too much, and I love to play pickleball, although I really am terrible at it. So in this podcast, we are going to exchange personal stories about living with HAE and how the disease can impact our daily life. We're going to explore challenges with having HAE and approaches to overcome them, including leaning into available support networks. We're going to also discuss approaches that may be helpful when talking with our healthcare providers about HAE and HAE treatment options. And in this episode, we will highlight one patient's experience with HAE, including her journey to find an on-demand treatment that met her needs. On-demand treatment is the medication you use once a swell starts, and it's also sometimes referred to as a rescue therapy. And so with that, I want to introduce you to our guest today, Kelly. Kelly, tell us a little bit about yourself.
Hi, Debbie. I'm so happy to be chatting with you. I live in Maine and I'm the Senior Vice President of Operations for Girl Scouts of Maine. And as you said, I love to travel.
So where do you like to travel? What are your favorite places?
Whether it's someplace new or someplace I've never been before, I love to be on the move. But I would say some of my favorite places are Scotland and Austria. Those have been my 2 favorite trips that I've taken abroad. I just love going new places. I also really enjoy cooking like you. So I love trying new recipes and altering them and seeing how they can kind of make them my own. I was first diagnosed with HAE with normal C1 inhibitor when I was 38, which was 3 years after I first experienced swelling events. How about you, Debbie?
Oh, I wasn't diagnosed until 40 years after my first experience, which is a terrible lifestyle to have to go through. I'm so glad that you found what was going on with you way before that. Kelly, what was your life like in that time between having your first HAE swell and getting the diagnosis? You said there was a 3-year period there. So what was that like? How did you feel? How did your daily activities change?
Yeah, so my first swell was a face swell, and it was really scary. It happened very quickly. I was actually on a plane, and I had no idea what was happening to me. There's nobody else in my family with HAE, so this was something that was totally new. I saw a doctor when I got home, and they thought it must be an allergic reaction. So I was put on antihistamines and steroids, but they didn't help. And so that initial swell eventually subsided, but I continued to have swells for about 3 years before I finally received that diagnosis. And during that time, I had no idea, when I would have a swell, what would trigger a swell, or how to stop or even prevent the swells from occurring. HAE swells have, really big impact on my life. There were days that I couldn't work or do things socially because the swells were painful, they were uncontrollable and unpredictable. I stopped traveling because I was scared and anxious that I'd have a severe swell and be away from home and not know how to handle it.
That had to be really devastating to you, somebody who loves to travel, a big part of your life, and all of a sudden have to stop that because of this crazy thing that was happening to your body.
It was absolutely life-changing.
So, Kelly, again, I think you said it was 3 years when you had your first swell and got your diagnosis.
It
What did
was.
you learn about HAE when you found out you had it?
Well, Debbie, when I was first diagnosed, I was first of all really relieved to finally have that diagnosis. But then I was also really overwhelmed because I didn't know anyone who had HAE. So I was confused first because nobody in my family had it. I thought that it had to be inherited or passed down in my family, but in my research I learned that it can show up in someone with no family history of the disease. So I tried to learn as much as I could about HAE. I spoke with my doctor, I looked online, I found the Hereditary Angioedema Association, or HAEA, and I found that HAE is a rare disease and that HAE with normal C1, which is what I have, is a rare form of this rare disease.
A double whammy,
A
right?
double whammy, right? So I learned as much as I could because it was like to me the rarest of the rare. So I learned that swelling in your body is controlled in part by a protein called a C1 esterase inhibitor, often just called C1 inhibitor. And the swells experienced during an HAE episode is from fluid in your blood vessels leaking into other tissues. I then talked to my doctor, and they emphasized that I should always have access to at least 2 doses of an on demand treatment to manage swells so they don't get worse and so that I can return to my daily activities as soon as possible. So that's why my doctor quickly prescribed me on an on demand HAE treatment and told me that every swell is eligible for treatment.
When I first heard about HAE, it was my family doctor, and he suggested that I go home and read about it. He actually wrote the name down on a little sticky note. And when I went home and Googled, I thought, oh my gosh, I'm reading my life story. And then, like you, I just wanted to soak up as much information as I could.
Mhm.
So, okay, now you have your diagnosis, and your doctor has started you on treatment. What did you expect from that medication? And did you learn ways to be ready for a swell? How was your life and your day-to-day experience? How is it different now that you have a swell when you have medication?
My days were definitely different because I had a sense of relief by having medication that I could use to treat my swells. It was definitely a comfort to know that not only did I have the diagnosis, but now I had a medication to treat my swells. And as I learned more about HAE, I became more in tune with what may trigger a swell for me. So, for me, my swells are mainly triggered by stress, if I'm injured or in pain, or when I'm sick. So, however, Debbie, as you well know, a swell can happen at any time. So, some of
Mhm.
them come without much warning, but I did try to learn a little bit more about what they feel like in the early stages so that I could treat the swell immediately. I wanted to be able to take the medication, get back to my life, not have it, interrupt my travel if that's what I was doing. And so the sooner I was able to treat as well, the sooner it's resolved. So for me, it's really important to keep my on demand treatment readily available 24/7. One thing I noticed is that I valued an on demand treatment that would work for me in one single dose.
Mm.
If my on demand treatment couldn't resolve a swell in just that one dose, I was worried about being in pain, being unable to do the things that I really wanted to do. I think it's really easy to tell someone, well, just take another dose. But in reality, that means waiting to see if the first dose works, weighing the options of if I should or could take another dose, depending on how many doses I have on hand. All the while, I'm missing out on doing the things that I want to do.
Right, Kelly. We want these swells to resolve as quickly as possible so we can get on with our lives. I mean, we do have more important things to do than deal with a swell. With that, we thought it would be helpful to talk through what a conversation with your doctor about retreating might look like. Retreating is when you have to take more than one dose of an on demand treatment to relieve one HAE swell. So, I want to introduce a special guest to join our discussion on that topic. Hi, Dr. Eades. Welcome.
Hi, Debbie and Kelly. I'm excited to speak with you. I am Dr. Eades, and I have been practicing medicine for over 27 years in Savannah, Georgia. My specialty is allergy and immunology, which includes the management of hereditary angioedema. Retreating can be a very frightening thing, especially for a patient, but also for the physician. Obviously, there is the immediate concern for the patient's health and well-being, but there also develops an understandable lack of confidence in the medication. One example that springs to mind involved a patient with HAE type 2 who over many years had tried various on-demand treatments. After having to consistently retreat with their rescue medication, the patient lost confidence and began repeatedly going to the emergency room in his hometown to receive replacement C1 inhibitor at the discretion of his physician. I want to reiterate that on-demand medication should always be accessible to the patient so that they can administer their treatment promptly after a swell begins. Relying on the emergency room can have several pitfalls. For example, the doctor on call may not be familiar with HAE and how to treat swelling resulting from HAE. If you are traveling, access to an emergency room may be more difficult. For this patient, they preferred receiving treatment at the emergency room rather than having a rescue medication that they could not count on to resolve a swell.
Dr. Eades, how can you tell when someone is retreating?
Thank you, Kelly. That's a great question. As far as identifying cases of retreating, I ask questions to see how things are going and encourage a good discussion with the patient during their appointment. To what extent have you been able to perform your daily activities and attend social events? How is your medication working for you? Do you treat all swells? Do any swells stand out as particularly painful, long-lasting, or requiring a trip to the emergency room? I often uncover cases of retreating through asking these types of questions. In addition, I ask all my patients if they have retreated their HAE swells since their last visit and how often. Also, I encourage my patients to track their swells. The free HAE and Me app is an easy-to-use tool to do just this very thing. By having records of your swells, you and your doctor can better assess your HAE management during appointments. Kelly, from what you have shared, it sounds like retreating was a significant concern. What would you want out of your on-demand treatment?
You're right, Dr. Eades. I had a similar conversation with my doctor and shared my concerns. I wanted something that could relieve my swells, hopefully with just one dose, and that could treat severe swells. Ultimately, we decided together to try RUCONEST.
An on-demand treatment option that may meet the needs of patients with HAE is RUCONEST. I like to start by telling my patients that RUCONEST, C1 esterase inhibitor recombinant, is an injectable prescription medicine that is used to treat swelling and/or painful attacks due to hereditary angioedema, or HAE, in adult and adolescent patients over the age of 12. RUCONEST increases functional C1 inhibitor, addressing the root cause of an HAE attack. RUCONEST is dosed at 50 units per kilogram with a maximum dose of 4,200 units. It is important to note that no more than 2 doses should be administered within a 24-hour period. Next, I'd like to share information about the efficacy of RUCONEST. In the clinical trial, about 9 out of 10 patients successfully stopped an HAE swell with just 1 dose of RUCONEST. The study included 44 patients. I also like to point out that in the open-label extension study, 44 patients experienced 170 HAE swells and received RUCONEST. In this study, 97% of swells needed just 1 dose of RUCONEST. In the primary clinical study, patients saw symptom relief with RUCONEST in 90 minutes versus 152 minutes in the group taking inactive liquid. RUCONEST has been shown to offer lasting symptom relief, stopping 93% of HAE swells for at least 3 days in a post hoc analysis of pooled data from 2 studies. Data for 72 hours was available for 68 of 127 patients, which included 280 swells treated with RUCONEST. Now, discussing safety is always important. In clinical studies, anaphylaxis was a serious adverse reaction that was reported. This serious event happened in a healthy volunteer who did not reveal their known rabbit allergy. The most common side effects that patients experienced were headache, nausea, and diarrhea.
What other safety information for RUCONEST should people with HAE be aware of?
I always emphasize to my patients that they should not use RUCONEST if they have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. My patients are always encouraged to call their doctor or the emergency department right away if they experience wheezing, difficulty breathing, chest tightness, turning blue, look at lips and gums, fast heartbeat, swelling, faintness, rash, or hives. A serious side effect of life-threatening hypersensitivity, anaphylaxis, was reported in a clinical study, so this is something to keep in mind. Also, you should not use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. Be sure to tell your doctor about all your medical conditions, including if you have a known allergy to rabbits. Before starting RUCONEST, of course, tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase your risk of clotting problems. I remind my patients that blood clots have occurred in patients receiving plasma-derived C1 inhibitor product and that they should always let their healthcare provider know if they are pregnant, breastfeeding, or planning to do so. In terms of side effects, the most common ones that patients experienced during clinical studies included headache, nausea, and diarrhea, but these are not all the possible side effects of RUCONEST. It is important to tell your healthcare provider about any side effect that bothers you or does not go away. You can also report negative side effects to Farming Medical Affairs at 800-930-5221 or contact the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. If symptoms persist, a second dose of RUCONEST may be taken at your recommended dose. Do not take more than 2 doses within 24 hours. For more information, please see the full prescribing information, including the patient product information. There have been no well-controlled prospective studies for the treatment of acute hereditary angioedema swells in people with HAE with normal C1 inhibitor. Therefore, the safety and efficacy of C1 inhibitor replacement therapy in this patient population are unknown.
After weighing all the risks and benefits, my doctor and I determined that RUCONEST was right for me. But all patients with HAE should talk to their doctor to see if RUCONEST is right for them.
So, Kelly, once you've gotten started on RUCONEST, how has your experience been with it?
Well, Debbie, with RUCONEST, I found an on-demand treatment that works for me. What's really made a huge impact for me is the one and done treatment. I very rarely have to retreat my swell, and it's freeing to know that I have an on-demand treatment that works for me and allows me to get back to doing what I love. I'm able to confidently make plans without a fear of having to cancel them due to a swell. I'm also traveling again, and I bring my RUCONEST with me everywhere I go. While my fear and anxiety of having a severe swell isn't totally gone, I don't find myself dwelling on it as much because I have confidence in my on-demand HAE treatment.
That's great. I'm so glad to hear that it's been effective for you. Finding the right treatment plan is so important. Kelly, thanks so much for sharing your story with us. And before we close out tonight, what main points would you like our audience to remember from this whole conversation?
Debbie, I'm a big believer in talking with your doctor to have a shared decision making. If you feel like your treatment isn't working or meeting your expectations, talk with your doctor to see if there are other options you can try. Resolving my HAE swells with one dose of RUCONEST has allowed me to return to the things that I love to do, and I'm more confident in my ability to manage my HAE.
Those are great reminders for everyone. Again, Kelly, thank you so much. Um, this information has been informative for all of us, and I appreciate you being open to discussing your HAE journey with us. And Dr. Eades, thank you also for joining us today, and thank you for your dedication to helping people with HAE. And listeners, thank you also for tuning in and engaging with us. In the next episode, we're going to hear from Alex as she shares her experiences with HAE, RUCONEST, and available support programs. I hope you will all join us.